Dear friends from the press, good morning. Now we are holding the press briefing for the containment of COVID-19. Shanghai. This is the 155th edition, and this is an online press briefing, and we will take your questions later. Now I'd like to introduce the guests. From the local health commission, Ms. Wu Qianyu. From the local commerce commission, Ms. Liu Min, and Ms. Ding Bo from the local government, and Ms. Bi Lei from the Fengxian district vice head. Now I first like to give the floor to Ms. Wu Qianyu to brief you the latest situation. Good morning, dear friends. As there have been 3,590 newly confirmed cases and 19,923 asymptomatic cases, and many cases were detected. 357 cases were detected in the nucleic acid tests, and 922 cases were turned from asymptomatic cases to confirmed cases. And many of the cases were detected in the closed-loop isolation, and more cases were discovered in the nucleic acid test screening. Now, there are 13 severe cases in hospitalization, including 11 male cases and 2 female cases. And most of them were elderly, the age between 17 to 93, and they were diagnosed many basic health issues. As of the 9th of 9 o'clock of this morning, there has been 327,000 cases, confirmed cases of COVID-19. And we are trying to screen out the negative cases and severe cases. And the confirmed cases have been put into the control. And we are still doing the screening tests for the nucleic acid tests. 969 cases were discharged from hospital, and 19,800 were discharged from medical observation, and they will receive community monitoring after they return to their homes. So we will not hesitate, and we will not hesitate in providing the best treatment to our residents, and we will provide the utmost support to the people. Yesterday, we issued a new notice for strengthening the medical help to the residents in Shanghai. And we are trying to detect the loopholes and the problems in the process of providing medical service. And this is so much for my part. Thank you, Ms. Wu Qianyu, for your introduction. Now the floor is open for questions. Please identify yourself before raising a question. Thank you, the host. I'm from the First Economic Daily. I think the online shopping platform is providing better service, but there are still many problems. Could you further give us more information? Under the impact of the COVID-19 situation, there has been some problem with the online shopping platform. Many delivery persons were trapped in the community. They cannot offer services to the people in a timely manner. So the potential of the shopping platform cannot be released. we were try to do our utmost to provide the best service to the residents, and we have done the following things to improve the situation. First, we restore the shopping capacity of the shopping platforms. We are trying to open as many as the shopping platforms. Now, 42 shopping sites have been reopened, benefiting 95% of the people. And 779 shopping points have been opened. So now the delivery persons, the amount of delivery person has amounted to 18,000 in Shanghai, and the daily service orders amounts to 1.8 million. Secondly, the shopping platforms take their own initiative to expand their capacity. For example, we have organized over a dozen of vegetable delivery points in order to deliver the vegetables to our people in the direct manner. We have received the great support from the Kunshan district of Kunshan city of Jiangsu province. The JD online shopping platform has dispatched over 700 vehicle services delivering 4,200 tons of food and vegetables to our people. Third, and we have organized the community service to offer help to our people, and they offer over 600 daily service. As to the second question, from the 8th of April, we tried to consolidate the offline stores to restore their business performance. Now, over 1,011 offline stores have restored capacity, improving their capacity by 37%. And they are still trying to improve their capacity and storage to provide oil, meat, and staple food to our people, and to match the needs of our people. And people also utilize the online shopping applications to cooperate, and these suppliers work together with the third-party organizations to deliver food to our people. For example, a famous brand of food supply also provided a great amount of food to our people. We also expand our cooperative brands with Yonghui supermarket and other home brands. And we have dispatched over 500 delivery vehicles. And also, we worked closely with the postal services to match the basic needs of the key regions. Lastly, I have a new piece of news for you. The Pinghu city of Zhejiang province, Kunshan city of Jiangsu province, and the west suburb supermarket wholesale market of Shanghai have established a food intermediate agency for improving the food supply to Shanghai. The floor welcomes more questions. Thank you. I have a question for the Shanghai Health Commission. The drug delivery for the Shanghai people is still slow. Could you brief us how we can improve this service? Well, you have raised a good question. Indeed, some people face the problem of long commuting and the long distance delivery of drugs. First, we will solve the problem of the internet service of the drugs. There are 185 online hospital clinics for Shanghai people where you can get drugs. But due to the COVID-19 epidemic and also due to the requirement of the disinfection and also because some delivery men were in isolation, people cannot get their medicine in a quick manner, but we are trying to improve the speed of delivering the medicine to our people. We have worked with the Shanghai Medical Group to provide a better service to our people, especially the elderly. Just now, our colleague introduced how we improved our services in each department. Secondly, we will prescribe and deliver as many medicine as long as they are needed. We worked with Shanghai Postal Service Group and other departments. And we have opened a special line for delivering and we give green light to the demand of delivering the medicine to our people. Thirdly, we improved the medical service at community level, and we opened up new channels for delivering the medicines. The community have been collecting the needs of our residents, and we put in place a new system of classification of the medical demand. For those people who are in isolation and who are in a closed management, the community health centers will come to their help for delivering the drugs. And the people can get the prescribed medicine for as long as 3 months, for up to 3 months. There are some special drugs for treating psychological problems and also tumors. We have a special place for giving where you can get the medicine easily. We're also trying to expand the functions of the medical supply, and this is a self-aid online platform. You can receive the online help, including consulting service and treatment. So this is a new platform and a new way for you to get medical help from the government. The floor is open for more questions. Thank you. I'm from 21st Century Economic Daily. Some people cannot be transported to the hospital in a timely manner. How can we improve the situation? Thank you for this question. Recently, the number of confirmed positive cases is on the rise, and this presents pressure for the government. And many cases face the problem of not being able to get a car in a timely manner and not being able to carry it to the isolation sites quickly. First, we will try to improve the number of medical beds, and we will take other measures. For example, in the makeshift hospitals, and the people will be settled in the medical bed first, and they will be transported to other special places for isolation later. And days ago, we have distributed the lists of positive cases to each community so that the community level can cooperate with the government for the transportation of the positive cases. And we have launched an online system for transporting the positive cases. And we have distributed the service. And we have popularized the service of makeshift hospitals across the community level so that the time of waiting can be shortened. And Shanghai is at a critical moment for the COVID-19 control and containment. The municipal government have turned a number of architectures into the makeshift hospitals, including the exhibition rooms and exhibition houses and the museums and hotels into the makeshift hospitals. When facing a COVID-19 outbreak, many schools will be turned into the makeshift hospital or be isolated. So I'd like to thank you for your understanding. We will kindly advise the utmost, the severest disinfection across these places. Thank you. I'm from the Oriental Net. A supermarket in Fengshan district has received a lot of attention online. So how can we solve this problem of the last 100-meter delivery of food service to people? Thank you for your question. I'd like to brief you give you the more information on the supermarket in Fengshan district. It is very important to provide food and basic necessities to our people. We'd like to help ensure the food supply when for our people without going for them to go out of their homes. So we put in place the shopping stores at the community level. So they have three functions. First, they can provide a supply for our people, and this includes larger supermarkets and the chain stores. And secondly, for the diapers and milk powders, and these are of special needs to our people, we will provide basic supply to the residents to care for the more vulnerable part. And as of today, there has been 443 supermarkets like Mantianxin supermarket in Fengshan district, and daily orders amounts to 450,000. And we completed 772,000 daily orders for special needs to our people, benefiting the community level to a great amount. We have received special demand orders for 20,000. And later we will provide 200 tons of rice, 200 tons of meat, and 200 tons of milk to our people in the district. We will provide special hands to help our people to collect their needs, the list of their needs, and prepare the list of delivery to our people. And we have also called on the volunteers to go to the community to provide the best service to our people across the last 1 kilometer. And in the future, we will further improve the categories of food supply to our people so that their basic needs for life can be met. Thank you. Thank you. I'm from Economic Daily. I have a question for Baiyuan Group. So how did the Baiyuan Group do to meet the basic necessities of our people? Well, over the recent days, we have opened many shopping stores in the community level and also opened online stores to provide the food supply for over 12 million residents in Shanghai, including 5 billion pieces of emergent food orders. And we will continue to provide more food supply for our people to ensure they can live well and eat well in times of the COVID-19 containment. We will ensure that the stores are opened as many as possible and our staff return to their posts as many as possible. Just now, one of the speakers said it is important to meet the food supply of our people. We are also very worried about the needs of our people. Now, 60% of the supermarkets have reopened business, and most of our employees have returned to their posts. And yesterday, 761 stores have reopened. We asked our stores to keep opening to the people, although the people cannot go outdoors to shop offline. For the offline chain stores, we implemented a severe disinfection and containment measures. Another measure is to increase the supply. The COVID-19 case epidemic has put us into a severe situation. On the one hand, we have to match the staff to fulfill the needs of our people. On the other hand, we have to increase the supply, including the meat, rice, oil. So we'd like to provide the best help to the community level. We also work together with China Postal Service Group to provide the delivery service to our people. We also launched an online platform of the Bailian Group. Our people have stayed in the chain stores in a closed loop. But we are working very hard to provide our best service to the people. And one of the things they do is to reorganize the food packages from the shelf, get them off the shelf and repackage the food in order to deliver them to our people. We also strengthened our containment measures and strengthened our service in the key regions, especially providing better service to the elderly. In many places the people face a long time on containment and isolation. We provided the online delivery service to our people, and we will also provide a medical service to the people. One last question. Thank you. I'm from Pengpai News. It is very important to implement a good work of the nucleic acid tests. So what have you done in this area? The delivery man has a large number, but they are exposed to the greatest danger of getting infected. We will try to provide them the best help. The municipal government has issued a new document to strengthen the disinfection in the stores, supermarkets, the medical stores. And in these places, we will give them preferential treatment in the nucleic acid tests. And they will receive 2+2 nucleic acid tests. That means 2 antigen tests twice within 2 days, and 2 nucleic acid tests within 2 days. And they will do this every other 2 days. We have provided a special testing sites for the delivery man. As they work and live together, we provide the health service centers adjacent to their to where they stay. Each district will provide the strongest support in terms of the nucleic acid tests, and we will ensure that their testing reports will be produced at the earliest time. And we require the community to do the antigen tests and the nucleic acid tests for the delivery man. But we are still in an early period of implementing the measures. We will continue to improve our service and provide a stronger help to the delivery man so that they can deliver the service in a safe way and their own safety will be protected. Well, thank you. Now, this press briefing is over. If you have other questions or other media requests, please contact our information office. Thank you for your interest.